You're getting 8 hours of sleep, you're going to bed at a reasonable time, you're not drinking caffeine late in the day, and yet every single morning you wake up feeling like you haven't slept at all. The fatigue hits you the moment your alarm goes off. You need coffee immediately just to function. You feel foggy and sluggish for the first 2 hours of the day. And this has been happening for months or even years, to the point where you've started to believe that waking up tired is just how mornings are supposed to feel. But here's what most people don't realize. Waking up unrefreshed despite adequate time in bed is not normal. It's not just poor sleep hygiene or stress. In most cases, it's a sign that your sleep architecture has been disrupted at the physiological level. Either you're not cycling through the proper stages of sleep, or your body is experiencing repeated arousals throughout the night that fragment your sleep without fully waking you, or your hormone systems that regulate sleep and wakefulness are dysregulated. The result is that you're spending 8 hours in bed but only getting 3 or 4 hours of restorative sleep. Your brain and body aren't completing the repair processes that sleep is meant to accomplish, which is why you wake up feeling worse than when you went to bed. And done. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AANDE, I've treated thousands of patients whose chronic health problems were rooted in poor sleep quality. I've seen people present with uncontrolled blood pressure, weight gain, depression, cognitive decline, and metabolic dysfunction. And when you dig into their history, almost all of them report waking up tired despite spending adequate time in bed. Sleep disruption doesn't just make you tired, it accelerates cardiovascular disease, impairs glucose metabolism, weakens immune function, and increases your risk of dementia. Poor sleep is one of the most under-recognized drivers of chronic disease in modern medicine. My goal now is to help people understand what's actually disrupting their sleep so they can address the root causes rather than just accepting fatigue as normal or masking it with caffeine stimulants. Because the interventions that restore sleep quality are specific and evidence-based, and they work when they're targeted at the actual mechanisms causing the disruption. Now, before we continue, I want to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in sleep physiology and the research that actually explains why sleep becomes disrupted and how to fix it. I'm not here to sell you sleep supplements or gadgets. I'm here to explain the biology so you can identify what's breaking your sleep and address it systematically. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time, or you haven't learned something that helps you understand your own sleep problems, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine about restoring restorative sleep. So please help me out. Hit the subscribe button to help this channel reach more people like you who deserve to wake up feeling rested and energized. And let's continue. To understand why you wake up tired, we need to understand what actually happens during normal sleep and what determines whether that sleep is restorative or fragmented. Sleep is not a passive state where your brain and body just shut down for 8 hours. It's an active, highly organized process that cycles through distinct stages, each with specific functions. When those stages are disrupted, or when you don't spend enough time in the deeper stages, you wake up unrefreshed, no matter how long you were in bed. Normal sleep architecture consists of 4 stages that repeat in roughly 90-minute cycles throughout the night. Stage 1 is light sleep, the transition between wakefulness and sleep. Stage 2 is slightly deeper sleep, where your heart rate slows and your body temperature drops. Stage 3 is deep sleep, also called slow wave sleep, where your brain produces slow, high-amplitude delta waves. This is the most restorative stage for physical recovery, immune function, and metabolic regulation. And then there's REM sleep, where your brain becomes highly active, your muscles are paralyzed to prevent you from acting out dreams, and memory consolidation and emotional processing occur. A healthy night of sleep cycles through these stages multiple times, with deep sleep concentrated in the first half of the night and REM sleep increasing in duration toward morning. If you're getting adequate amounts of deep sleep and REM sleep in the proper sequence, you wake up feeling refreshed. If those stages are shortened, fragmented, or eliminated, you wake up feeling like you haven't slept at all, even though you were unconscious for 8 hours. There are 3 primary mechanisms that disrupt sleep architecture and cause you to wake up tired. The first mechanism is sleep fragmentation from micro-arousals. These are brief awakenings, often lasting only a few seconds, that pull you out of deep sleep or REM sleep back into lighter stages. You're not conscious during these arousals, so you don't remember them, but they prevent you from spending adequate time in the restorative stages of sleep. The most common cause of micro-arousals is obstructive sleep apnea, where your airway collapses repeatedly during the night, causing oxygen desaturation and arousal responses. But micro-arousals can also be caused by restless leg syndrome, periodic limb movement, pain, nocturia, which is waking to urinate, and even gastroesophageal reflux. The second mechanism is dysregulation of the hormones and neurotransmitters that control sleep and wakefulness. Your body follows a circadian rhythm that's controlled by the suprachiasmatic nucleus in your brain, which responds to light exposure and releases signals that regulate cortisol, melatonin, and other sleep-wake hormones. Cortisol should peak in the morning to wake you up and drop at night to allow sleep. Melatonin should rise in the evening as light decreases and drop in the morning as light increases. When this rhythm is disrupted by irregular sleep schedules, excessive evening light exposure, shift work, or chronic stress, your hormonal signals become misaligned. You end up with elevated cortisol at night, preventing deep sleep, and insufficient cortisol in the morning, leaving you unable to wake up properly. The third mechanism is poor sleep pressure regulation. Sleep pressure is the biological drive to sleep that builds throughout the day as adenosine accumulates in your brain. The longer you're awake, the more adenosine accumulates and the stronger your drive to sleep becomes. When you finally sleep, adenosine is cleared and sleep pressure resets. But if you're consuming caffeine late in the day, which blocks adenosine receptors, or if you're napping excessively during the day, which dissipates sleep pressure prematurely, your drive to sleep at night is reduced. You may fall asleep because it's your habitual bedtime, but your sleep is lighter and less restorative because your biological sleep pressure wasn't high enough. Now here's what most people have been told about waking up tired. You're not getting enough sleep, you need better sleep hygiene. Go to bed earlier, avoid screens before bed, keep your room dark and cool, make sure your mattress is comfortable, and while all of those recommendations have merit, they don't address the underlying physiological disruptions that are actually fragmenting your sleep or dysregulating your hormones. You can have perfect sleep hygiene and still wake up exhausted if you have untreated sleep apnea or if your cortisol rhythm is reversed from chronic stress. What the research is now showing us is that sleep quality is determined by measurable biological factors, including sleep architecture, hormone levels, and neurotransmitter function. Studies using polysomnography, which records brainwaves, oxygen levels, heart rate, and muscle activity during sleep, have demonstrated that people who report waking up tired despite adequate time in bed often have dramatically reduced time in deep sleep and increased sleep fragmentation. Research published in the journal Sleep has shown that even modest reductions in deep sleep are associated with daytime fatigue, cognitive impairment, and increased inflammatory markers. The missing mechanism that nobody explained to the public is that sleep disruption creates a vicious cycle. When you don't get restorative sleep, your stress hormones stay elevated, which makes it harder to sleep deeply the next night. Your glucose metabolism becomes impaired, which increases nighttime blood sugar fluctuations that cause arousals. Your inflammatory markers rise, which interferes with sleep-promoting neurotransmitters. And your appetite-regulating hormones become dysregulated, causing you to eat more and gain weight, which increases your risk of sleep apnea. Poor sleep begets worse sleep, and without intervention, the problem compounds over time. Research in populations over 50 has shown that sleep architecture naturally changes with age. Older adults spend less time in deep sleep and more time in lighter stages, which is partly why older people report more frequent awakenings and less refreshing sleep. But this age-related change is accelerated dramatically by factors like obesity, sedentary lifestyle, medication use, and chronic disease. The decline in sleep quality is not entirely inevitable. It's influenced by modifiable factors that most people are never told to address. Here's the mistake that's being made, and it's keeping millions of people trapped in chronic fatigue. People are treating waking up tired as a sleep quantity problem, when it's actually a sleep quality problem. They go to bed earlier to get more hours, but they still wake up exhausted because the hours they're getting aren't restorative. They try sleep supplements like melatonin or magnesium, which might help them fall asleep faster, but don't address the underlying disruptions that fragment their sleep throughout the night. They accept their fatigue as normal aging, when in reality, it's a sign of measurable physiological dysfunction that could be diagnosed and treated. Think about how this plays out in everyday life. You've been waking up tired for years. You assume you're just a person who doesn't sleep well. You compensate by drinking multiple cups of coffee throughout the day to stay functional. The caffeine keeps you going, but it also stays in your system for hours, blocking adenosine receptors in your brain and reducing your sleep pressure when bedtime arrives. You go to bed at your usual time, but your brain isn't ready for deep sleep because your sleep drive has been artificially suppressed. You spend the night in lighter stages of sleep, waking frequently without realizing it, and the next morning you wake up tired again. The cycle repeats. Or consider this scenario. You've been under chronic stress for months or years. Your cortisol, which should peak in the morning and drop at night, is elevated all day and into the evening because your body is in a constant state of sympathetic activation. When you lie down to sleep, your cortisol is still too high to allow the transition into deep sleep. You drift through light sleep and wake repeatedly, though you may not remember the awakenings. Your sleep is fragmented and unrestorative. You wake up exhausted because your body never fully shut down. But when you go to your doctor, your cortisol isn't measured at night when it's elevated. It's measured in the morning when it's supposed to be high anyway. The dysfunction is missed entirely. Or think about sleep apnea, which affects approximately 25% of men and 10% of women over age 50, most of whom are undiagnosed. Your airway collapses dozens or even hundreds of times per night. Each collapse causes your oxygen level to drop and your brain to send an arousal signal to restore breathing. You're pulled out of deep sleep into lighter sleep over and over throughout the night. You have no awareness that this is happening. Your partner may notice that you snore or gasp for air, but you dismiss it because you don't feel like you're waking up. Meanwhile, your sleep is catastrophically fragmented. You're spending almost no time in the restorative stages. And every morning you wake up feeling like you've been hit by a truck. The conventional approach has been to treat the symptom, which is fatigue, rather than diagnosing the underlying sleep disruption. Patients are told to improve their sleep hygiene or prescribe sleeping pills that induce sedation but don't produce natural sleep architecture. Sleeping pills like benzodiazepines and non-benzodiazepine hypnotics suppress deep sleep and REM sleep while increasing lighter stages. You're unconscious, but you're not getting restorative sleep. You wake up feeling groggy and unrefreshed, sometimes worse than before you started the medication. What's missing is systematic assessment of sleep quality, rather than just sleep duration. How much time are you actually spending in deep sleep and REM sleep? Are you experiencing arousals that fragment your sleep? Is your cortisol rhythm normal or reversed? Is your airway patent during sleep or collapsing repeatedly? These questions require objective testing, not just asking someone if they feel rested. But objective sleep testing is rarely ordered unless someone presents with severe symptoms or their partner reports witnessed apneas. If you're starting to realize that your morning fatigue might have a specific physiological cause rather than just being how your body works, then please hit that subscribe button now. This channel is dedicated to explaining the mechanisms behind common health problems so you can get the proper diagnosis and treatment you need. Now let's discuss what actually restores restorative sleep and allows you to wake up feeling rested. I'm not going to give you generic sleep hygiene advice that you've already heard. What I'm going to explain are the specific interventions that address the mechanisms we've discussed, interventions that are supported by evidence and that actually work when the underlying problem is properly identified. The first intervention, and this is critical, is to rule out or treat obstructive sleep apnea if it's present. If you snore loudly, if your partner has noticed that you stop breathing during sleep, if you wake with a dry mouth or headache, if you have excessive daytime sleepiness despite spending adequate time in bed, you need to be evaluated for sleep apnea. The gold standard test is an overnight polysomnography in a sleep lab, though home sleep tests are now available and can diagnose moderate to severe cases. If sleep apnea is diagnosed, treatment with CPAP, which is continuous positive airway pressure, oral appliances, or in some cases, surgery can completely eliminate the airway collapses and restore normal sleep architecture. Research published in the American Journal of Respiratory and Critical Care Medicine has demonstrated that treating sleep apnea dramatically improves sleep quality, reduces cardiovascular risk, and eliminates daytime fatigue in the vast majority of patients. The second intervention is to restore proper cortisol rhythm through stress management and circadian alignment. Your cortisol should follow a predictable daily pattern, high in the morning and low at night. When that pattern is reversed or flattened due to chronic stress, your sleep suffers. The interventions that restore cortisol rhythm include consistent sleep and wake times to reinforce circadian signals, morning light exposure, which suppresses melatonin and stimulates cortisol appropriately, stress reduction practices like meditation or deep breathing, which lower sympathetic activation, and avoiding intense exercise or stressful activities in the evening, which can elevate cortisol at the wrong time. For some people, adaptogenic herbs like ashwagandha or phosphatidylserine supplements have been shown in research to help normalize cortisol patterns, though these should be used under guidance. The third intervention is to optimize sleep pressure by managing caffeine intake and avoiding late-day naps. Caffeine has a half-life of approximately 5 to 6 hours, which means that coffee consumed at 3 p.m. still has significant levels in your system at 9 p.m. That residual caffeine blocks adenosine receptors and reduces your biological drive to sleep. The recommendation is to avoid caffeine after early afternoon, and for some people who are particularly sensitive, avoiding it after noon is necessary. Similarly, long or late-day naps dissipate sleep pressure and make it harder to fall into deep sleep at night. If you need to nap, keep it to 20 to 30 minutes and do it before mid-afternoon. The fourth intervention is to address any medical conditions or medications that disrupt sleep. Chronic pain, gastroesophageal reflux, restless leg syndrome, and nocturia all fragment sleep and should be treated. Many common medications, including beta blockers, corticosteroids, some antidepressants, and stimulants, can interfere with sleep architecture. If you're on medications and experiencing sleep problems, discuss alternatives with your physician. In some cases, changing the timing of medication administration can reduce sleep disruption without requiring a different drug. The fifth intervention is to support deep sleep through lifestyle factors, including regular exercise, temperature regulation, and nutrient adequacy. Exercise, particularly resistance training and moderate intensity aerobic activity, increases time spent in deep sleep. The mechanism involves increased adenosine accumulation during exercise and improved insulin sensitivity, which stabilizes nighttime glucose. However, intense exercise too close to bedtime can elevate cortisol and interfere with sleep, so it should be completed at least 3 to 4 hours before bed. Body temperature regulation also affects sleep depth. Your core temperature needs to drop to initiate sleep, which is why sleeping in a cool room around 65 to 68 degrees Fahrenheit supports deeper sleep. And certain nutrients, including magnesium, vitamin D, and omega-3 fatty acids, have been associated with improved sleep quality in research, particularly in people who are deficient. The sixth intervention, for people with confirmed circadian rhythm disruption or delayed sleep phase syndrome, is timed light exposure and potentially melatonin supplementation. Light is the most powerful circadian signal. Bright light exposure in the morning shifts your circadian rhythm earlier, making it easier to wake up and fall asleep at conventional times. Evening light, particularly blue light from screens, shifts your rhythm later and suppresses melatonin. Using blue light blocking glasses in the evening or avoiding screens altogether for 2 hours before bed can improve melatonin production. For some people, low-dose melatonin, 0.5 to 3 milligrams taken 30 to 60 minutes before desired sleep time, can help reset circadian rhythm, though it should be used strategically rather than chronically. And critically, if you've tried these interventions and you're still waking up tired, you need objective testing. A sleep study can identify apnea, periodic limb movements, and other disruptions. Cortisol testing through saliva samples collected at multiple time points throughout the day can reveal rhythm abnormalities. Thyroid function testing can identify hypothyroidism, which commonly causes fatigue and sleep disruption. Iron studies can detect deficiency, which contributes to restless legs. The point is that persistent sleep problems deserve diagnostic evaluation, not just acceptance or self-treatment. The In emergency medicine, we see the downstream consequences of chronic sleep disruption. We see people with uncontrolled hypertension that's resistant to multiple medications because their sleep apnea was never diagnosed. We see patients with diabetes whose glucose control is impossible because fragmented sleep drives insulin resistance. We see people with depression and anxiety that doesn't respond to antidepressants because the root cause is sleep deprivation. And we see cognitive decline and early dementia in people whose brains haven't had adequate deep sleep to clear toxic proteins for decades. These outcomes weren't inevitable. They were the result of sleep disruption that was never properly evaluated or treated. What I've observed in patients who restore their sleep quality is that the benefits extend far beyond just feeling more rested in the morning. Their blood pressure improves, their weight becomes easier to manage, their mood stabilizes, their cognitive function sharpens, their energy levels normalize throughout the day, and their overall health trajectory changes dramatically. Sleep is foundational to every other aspect of health, and when it's optimized, everything else becomes easier to manage. The bigger picture here is that waking up tired is not normal, and it's not something you have to accept. It's a sign that your sleep architecture is disrupted, your hormones are dysregulated, or you have an underlying condition that's fragmenting your sleep. These are diagnosable, treatable problems. The interventions exist. The testing exists. What's missing is awareness that persistent fatigue, despite adequate time in bed, deserves investigation, not dismissal. If this video helped you understand why you might be waking up tired and what you need to do to address it, then please subscribe to this channel. I'll keep creating content that explains the physiology of common health problems and gives you the knowledge to advocate for proper diagnosis and treatment. Thank you for watching, and I'll see you in the next video.